stop right there. Before you lace up your walking shoes today, I need you to watch this first, because what I'm about to share with you has been quietly changing the lives of thousands of men and women over the age of 75, and most doctors still aren't talking about it loudly enough. There is one single exercise, just one, that a growing number of surgeons and physical therapists are now calling more effective than walking for people over 75. It protects your joints, rebuilds your strength, sharpens your balance, and keeps you out of the hospital. And no, it is not running. It is not swimming. And it is definitely not some expensive machine at a gym. Stay with me, because by the end of this video, you are going to know exactly what it is, why it works, and how to start doing it safely today. Welcome back to the channel, and if you are new here, this is the place where we talk honestly and practically about living your strongest, healthiest life after 70. I am so glad you are here today, because this topic is one I feel genuinely passionate about. We live in a world that constantly tells older adults to just go for a walk. And look, walking is wonderful. Walking has real benefits. But here is the truth that most people over 75 are never told: walking alone, especially at a gentle pace, is often not enough to prevent the muscle loss, balance decline, and bone density drop that begins accelerating after age 70. In fact, the medical community has a name for this process. It is called sarcopenia, which is the gradual loss of muscle mass as we age, and it is one of the leading hidden causes of falls, fractures, loss of independence, and early entry into nursing care. The good news? There is one exercise that directly fights sarcopenia, improves balance, strengthens your bones, and keeps your heart healthy all at the same time. Surgeons who work with elderly patients recovering from hip replacements, knee surgeries, and spinal procedures are increasingly prescribing this exact exercise as the gold standard for older adults. So let us get into it. The problem with walking alone after 75. Now, before I reveal the exercise, I want to make sure you understand why walking, despite being great, falls short for many people over 75. When you walk at a comfortable, everyday pace, your body is moving, yes, but it is not being sufficiently challenged to build or even maintain muscle. After the age of 60, we naturally lose between 3 and 5% of our muscle mass every single decade if we do nothing to stop it. After 75, that rate can increase even further. Muscle is not just about looking fit. Muscle is what holds your skeleton upright. Muscle is what catches you when you trip. Muscle is what allows you to stand up from a chair without using your hands, carry your groceries, climb your stairs, and live independently in your own home. Walking does not build significant muscle. Walking does not meaningfully improve your grip strength. Walking does not challenge your neuromuscular system, that critical connection between your brain and your muscles, in a way that protects you from falls. And here is something most people do not realize: nearly 1 in 3 adults over 65 falls every single year. Falls are the leading cause of injury-related death in older adults. So while walking is still something I encourage everyone to do, if it is the only thing you are doing for exercise after 75, there is a serious gap in your routine. That gap is what the one exercise I am about to share directly fills. The exercise: chair-assisted resistance standing. The exercise is called resistance-based standing exercise, and the most accessible, surgeon-approved version of it for people over 75 is the chair stand, also known as the sit-to-stand exercise, performed slowly, intentionally, and with progressive resistance over time. Now before you think, "Oh, I have heard of that," stay with me, because the way most people do this exercise and the way it should be done for maximum benefit are completely different things. Here is the basic version. You sit in a firm chair with your feet flat on the floor, about hip-width apart. You fold your arms across your chest or extend them forward. Then, slowly and in a controlled manner, you rise to a full standing position. You pause for 1 full second at the top. Then you slowly lower yourself back down, taking a full 3 to 4 seconds to return to the seated position. That lowering phase, called the eccentric phase, is where the magic happens. It is where muscle fibers are rebuilt. It is where bone density is stimulated. It is where your nervous system is being trained to control movement and prevent falls. Most people rush this part. they plop back down into the chair. But the slow, controlled descent is the most important part of the entire movement. Surgeons and physical therapists prescribe this exact movement to patients recovering from hip replacements, knee surgeries, and even spinal procedures because it rebuilds foundational strength safely without putting dangerous pressure on the joints. And here is what makes it better than walking for the specific needs of adults over 75. Number 1. It directly builds leg muscle, the quadriceps, hamstrings, and glutes, which are the muscles most responsible for fall prevention. Number 2. It trains your body's balance and coordination in a functional, real-world movement pattern. Every time you get in and out of a car, off a toilet, or up from a sofa, your body is doing a version of this movement. Training it makes every part of daily life safer and easier. Number 3. It can be done in your living room, with no equipment, in under 10 minutes a day. What the research and surgeons say, this is not just something fitness influencers are recommending. The evidence behind resistance-based standing exercise for older adults is genuinely impressive. Studies published in journals focused on geriatric medicine have consistently shown that lower body resistance training, of which the chair stand is the most accessible form, reduces fall risk by up to 34% in adults over 70. Orthopedic surgeons who work with elderly patients recovering from joint surgery almost universally incorporate chair stands into the early rehabilitation protocol because they allow the patient to load the muscles safely, rebuild strength functionally, and return to independence faster than almost any other exercise. Dr. John Morley, one of the world's leading researchers on sarcopenia and aging, has repeatedly stated in published work that resistance exercise, not aerobic exercise alone, is the single most important intervention for preserving functional independence in older adults. The American College of Sports Medicine and the National Institute on Aging both recommend that adults over 65 engage in muscle-strengthening activities at least 2 days per week, specifically targeting the legs and core. The chair stand checks all of those boxes. It is resistance exercise. It targets the legs and core. It can be done 2 or more times per week with no equipment and no gym membership. And it is safe enough to be prescribed to post-surgical patients. If that is not a surgeon-approved exercise, I do not know what is. Let me walk you through exactly how to build this into your routine starting this week. In the first week, you are going to aim for 2 sets of 8 repetitions. 1 repetition means standing up fully and sitting back down slowly. Do this twice a day, once in the morning and once in the afternoon, on at least 3 days that week. Use a sturdy chair that does not slide, and if you need to, lightly rest your fingertips on a table in front of you for confidence, but try to do the actual work with your legs, not your arms. Focus on the lowering. Take 3 to 4 full seconds to sit back down. Do not plop. That slow descent is where you are building strength. In the second and third week, you are going to increase to 3 sets of 10 repetitions per session, still twice a day, 3 to 4 days per week. By week 4 and beyond, once this feels comfortable and your legs feel stronger and your confidence has grown, you can try adding a small challenge. You can hold a light weight, a water bottle, a small bag of rice, anything that adds a pound or 2 against your chest as you stand. Or you can try doing the movement with just one hand lightly touching the chair instead of 2. These small progressions are what signal to your body that it needs to keep building muscle. Here is something important. You may feel some muscle soreness in your thighs and buttocks in the first few days. That is completely normal. That is your muscles responding and rebuilding. However, you should never feel sharp pain in your knees, hips, or lower back. If you do, stop immediately and consult with your doctor or physical therapist before continuing. Also, always make sure your chair is on a non-slip surface, wear supportive shoes or non-slip socks, and consider having someone with you during the first few sessions until you are confident in the movement. Pairing it with walking for maximum results. Now here is something I want to be clear about. I am not telling you to stop walking. Walking is still a beautiful, beneficial activity. What I am telling you is that walking alone is not enough and that the chair stand exercise fills the critical gap that walking leaves. The ideal routine for someone over 75 who wants to maintain independence, prevent falls, and feel genuinely strong looks something like this. On most days of the week, you go for a walk. It does not have to be long. 20 to 30 minutes of gentle walking is excellent for your cardiovascular health, your mood, your circulation, and your mental sharpness. On 3 or 4 of those days, either before or after your walk, you also do your 2 sets of chair stands. The whole thing takes less than 45 minutes total, and the combination of cardiovascular exercise from walking and resistance exercise from chair stands addresses virtually every major physical health risk that adults over 75 face. Falls, bone density loss, muscle loss, heart health, balance, joint health, cognitive function, all of it. Together, these 2 simple activities form a complete fitness foundation that no expensive gym membership, no complicated class, and no fancy equipment can significantly improve upon for most people in this age group. The mental and emotional benefits. I want to take a moment to talk about something that does not get mentioned enough, which is the mental and emotional benefit of feeling physically capable and strong. When you can stand up from a chair without assistance, when you can climb a flight of stairs without gripping the railing in fear, when you can walk across a parking lot without worrying about losing your balance, that confidence is transformative. It affects how you socialize. It affects how much you leave the house. It affects how you feel about yourself and your future. Exercise, especially resistance exercise, has also been shown in multiple studies to reduce symptoms of depression and anxiety in older adults, improve sleep quality, and even slow cognitive decline. When you strengthen your legs, you are not just protecting your body. You are protecting your mind and your spirit. The people who stay vibrant, engaged, and joyful in their 70s and 80s and beyond are very often the people who move their bodies intentionally and consistently. It does not take hours. It does not take a gym. It takes a chair, a commitment, and a little bit of knowledge, which you now have. So here is what I want you to do right now. Do not wait until tomorrow. Do not bookmark this and forget it. Right now, after this video ends, I want you to get up, find a sturdy chair in your home, and do just 1 set of 8 chair stands. Slow on the way down. Count to 4. Feel your legs working. That is it. That is your starting point. And then come back to this video tomorrow and do it again. If this video helped you or someone you love, please hit that like button right now. It genuinely helps more seniors find this information. And if you have a parent, a grandparent, a neighbor, or a friend who is over 75 and could benefit from this, please share this video with them today. It could genuinely change the quality of their life. Subscribe to this channel if you have not already, because every single week we bring you honest, practical, doctor-informed health information designed specifically for older adults who want to stay strong, independent, and thriving. And drop a comment below. I read every single one. Tell me, are you going to try the chair stand today? Or have you been doing it already? I would love to hear from you. Thank you so much for watching. Take care of yourself, keep moving, and I will see you in the next video.